First, I like to acknowledge the source of most of the images I will use in this video, Anatomy Standard. I provide a link to the website in the description below. Before describing the tibia and fibula, we need to talk about the patella, or kneecap, which appears to be floating in this image. Here is a radiograph of the knee joint. The thigh bone, or femur, was described in a previous video. It articulates with the tibia, or leg bone, which is commonly called the shin bone. Here you have the patella. It has a smooth articular surface on the posterior side, which will glide over the patella surface of the femur as you flex and extend the leg at the knee joint. The patella is an atypical sesamoid bone, which is a bone that forms in the tendon of a muscle. Another prominent example of a sesamoid bone is the pisiform bone of the wrist, or carpus, which forms in the tendon of the flexor carpi ulnaris muscle. As the name sesamoid, or like a sesame seed, implies, sesamoid bones are usually small, and the smallness of the pisiform is suggested by the name, which means shaped like a pea. The patella is an exception to this smallness because it is fairly large and develops in the tendon of the large leg muscle, the quadriceps femoris muscle. The remainder of the tendon, which is now a ligament, connects the patella to the tibia and is called the patellar ligament. Here is a nice diagram of the knee joint that reviews the relationship of the patella to the other bones of the knee joint. Again, superiorly, you have the quadriceps femoris tendon, and inferiorly, the patellar ligament attaches the patella to the tibia at the tibial tuberosity. Here is the patella isolated. The anatomy is relatively straightforward. The bone has a triangular shape, and the proximal part that attaches to the tendon is called the base, and the distal part that comes to a point is called the apex. The terms are obviously derived from its triangular shape. If we turn the bone around and look at the posterior has a smooth articular surface that would be lined by hyaline cartilage in the living bone, and this is the articular surface. Now let's take a look at the tibia, beginning with the proximal end, which articulates with the femur. From the posterior view, we can see there are two relatively flat, smooth surfaces that will articulate with the corresponding condyles of the femur. So you have the medial and lateral condyles on the tibia. Here is an anterior view, and we can see tubercles between the condyles, to which the cruciate ligaments of the knee will attach. This raised portion of the bone between the condyles is called the intercondylar eminence. Below the condyles, on the anterior side, there is a raised roughened area to which the patellar ligament will attach. This roughened area is called the tuberosity, and this tuberosity is called the tibial tuberosity. Here is an anterior and posterior view of the tibia in isolation. The shank of the tibia in cross-section has a triangular shape which gives rise to margins between the lateral, medial, and posterior surfaces. The anterior margin is the most prominent and can be easily felt under the skin of the shin. This margin is called the anterior margin, or crest, and extends from the tibial tuberosity to what we will call in a second the medial malleolus. At the distal end of the tibia, on the medial side, a process extends or overhangs the talus of the tarsus, or ankle. This process is called a malleolus, which in Latin means little hammer. Think mallet in English, or malleus in Latin, and use a diminutive suffix and you have malleolus. This is one of the two processes that brace the ankle joint. This is the medial malleolus, and on the lateral side, the distal end of the fibula forms the lateral malleolus. On the inferior surface, there is a smooth articulous surface that will glide over the talus of the ankle joint. We will look at the tarsus in the following video. On the lateral side of the tibia, the lateral malleolus is accommodated by a notch that is simply called the fibular notch. The slender fibula is attached to the lateral side of the tibia. The word in Latin means brooch. The bone seemed to the ancient anatomists to be like an ornamental clasp attached to the side of the main bone of the leg, the tibia. The proximal end of the fibula is called the head, and you can distinguish the head of the fibula from the distal end by its relative size. It is smaller, and the fact that it articulates with the overhanging lateral side of the tibia in a way that gives the articular surface a more horizontal angle. The distal end of the fibula forms the lateral malleolus, as we have seen, and the articulation in the fibular notch of the tibia is more vertical or parallel to the length of the fibula. This brings our video to an end. Please look at my other videos. I have almost completed all the videos of the skeletal bones. Again, if you like my videos, please subscribe. Here are image attributions. And finally, here is yet another video of Apollo.